as we are to welcome Dr. Kristen Doss, who is going to take us back to a state perspective on COVID as it relates to the Department of Corrections. I have had the pleasure of working with Kristen on a number of committees and initiatives, and Indiana is very lucky to have and benefit from her leadership in the corrections area. She will be presenting on the DOC Comprehensive COVID-19 Response Plan, and her primary mission is to serve vulnerable Hoosiers by providing quality medical care to incarcerated individuals. Dr. Doss holds a bachelor's degree from IU Bloomington, and she earned her medical degree from Morehouse School of Medicine in Atlanta. She completed a triple board residency in general pediatrics, general psychiatry, and child adolescent psychiatry at IU School of Medicine. Her experience allows her the unique ability to examine systems of care and integrate physical and behavioral health needs to treat the whole person. Dr. Doss also served as a staff physician at Fairbanks, treating the physical and mental health needs of persons with substance use disorder. Finally, she taught students at the IU School of Medicine and Community Health Network, where she remains a volunteer faculty member. Thank you, Dr. Doss, for participating, and we look forward to hearing what you have to say.
Hi, my name is Dr. Kristen Doss, and I'm the Chief Medical Officer for Indiana Department of Correction. Today, I'm going to share an overview of the response and impact COVID-19 has had on the Indiana Department of Correction. COVID-19 and IDOC. First, as a little bit of background, I want to share exactly the work that Indiana Department of Correction does each and every day to keep our community safe. Indiana Department of Correction includes our state prison system. So these are folks who have been convicted of a crime in a county and then sentenced as a felon to the Indiana Department of Correction. Our agency has approximately 6,000 staff and 800 contracted healthcare staff, which include nursing, physicians, mental health providers, psychologists, dentists, and all those that it would take to run a healthcare practice. We serve nearly 27,000 incarcerated individuals, and that includes several special populations. So we have men, women, juveniles, we have an elderly population. We have several areas where we do a higher level mental health programming. We essentially have an inpatient unit at Newcastle Correctional Facility. We also have a full spectrum addictions recovery program with intensive treatment at one of our facilities as well. There are a total of 21 Indiana Department of Correction facilities statewide. And again, all healthcare is provided on site for the most part. If someone were to need emergent care or critical care, we of course would send that to a local hospital, but otherwise all other services are provided in-house. So what's the plan? Back almost towards the end of February, we came in and decided that COVID-19 is on the horizon. We need to make sure that our policies, procedures are together and up to date. So on our website, the Indiana Department of Correction website, you will find some background about our comprehensive response to COVID-19. On the website, you will see information on our response plan, kind of some precautions that we're taking within the facilities, information for families, and the way in which programming has been modified within our agency. Additionally, there are some COVID-19 DOC statistics that we post each and every day after 1 p.m. so that families and stakeholders and other interested parties can find exactly what our numbers are and track our trends. So we all know that congregate settings are especially areas of concern when it comes to COVID-19 and the response. So what are some things that the Indiana Department of Correction is doing? So we are screening staff upon every shift. So before anyone comes in to a correctional facility, we are asking them questions about how they're feeling. If they're not feeling well, we make sure that they go home. We have also put HR practices in place that won't necessarily penalize anyone for going home if they're not feeling well. Additionally, we take a temperature before anyone comes in, just to make sure that we're doing our part to stop the spread. Additionally, we are providing personal protective equipment to all staff and all offenders per CDC guidelines. So we have access to N95 masks, surgical masks. We have most offenders in cloth masks. Some offenders are in surgical masks as well. We have gloves, we have gowns, we have face shields, we have all the appropriate PPE that you would see if you were at a local hospital or in the community. All staff and offenders have access to water, soap, hand sanitizer, and disinfectants in each and every facility. And this really is something, the hand sanitizer piece is something that is new to corrections per ACA guidelines, so the American Correctional Association guidelines. We typically don't allow flammable alcohol-based products into correctional facilities for safety reasons. However, due to this national pandemic, we have ensured that each and every site, each and every staff member, and each and every offender has access to alcohol sanitizer, which is greater than 60%. We also have been mass producing a lot of personal protective equipment. Again, a lot of the masks, face shields, gowns, and sanitizers, hand sanitizer has been offender made. So one thing about this pandemic that has been encouraging to me is that our offenders, everyone wants to help do their part. And our offenders have stepped up to make over 40,000 masks, thousands of face shields, gowns, and gallons of hand sanitizer, and not just for the Indiana Department of Correction, but for other folks in the community and other teams as well. Additionally, another thing we're doing is we're moving quickly to quarantine and isolate all offenders if a possible exposure happens. And this is one piece about correctional healthcare that is quite different from the community or even other long-term care settings. Sometimes folks don't want to move quickly, and sometimes they don't want to be quarantined for 14 days. And I know we kind of all have had to feel that as we've had to all hunker down these last couple of months. But doing that in a correctional setting can present with additional challenges. So fortunately, we've really pushed the education piece to all of those who are incarcerated to say, this is why we're doing this, and this is really to protect you. And we're not doing anything to you that we aren't asking all Hoosiers to do, and that is to, if they're having symptoms, they need to be isolated. If they have been exposed to someone, they need to be quarantined, and they need to allow medical to come in to check their vitals, to check their temperature, to check in on them and ask how they're doing. So it's not anything that we're trying to disrupt, normal programming and all the other things that folks within our system like to do and enjoy doing, and that we want them to do. We want folks to stay busy. However, if they are sick or if they've been exposed, we have to do our part again to stop the spread. We have also been engaging with other local, state, and federal agencies to maintain safety and security. along with best medical practices. So we've been working with jails and the Indiana State Department of Health and the Bureau of Prisons and others, just to make sure that our response is coordinated and in line with other responses and best practices. We also have been utilizing our Indiana Department of Correction technical response team to decontaminate our facilities. And this team really was spun after the opioid epidemic to come in and decontaminate facilities that may have had a fentanyl exposure or something of the like. So these teams really are professionals in what they do, meeting federal guidelines to come in, clean, decontaminate an area with disinfectants and all the latest gadgets that are out there in the hazmat world to make sure that our staff and our offenders that are in a facility have a safe space. We've been maintaining a great partnership with the Indiana State Department of Health to activate strike teams for testing and infection control review. So if we notice that there have been multiple folks who have had symptoms or a certain number of folks who have tested positive within a facility, we move very quickly to reach out to ISDH to get a strike team out to come in and test those who may have been exposed, those who have symptoms, and then also make ourselves available to any feedback in regard to infection control practices. While we do have standards in place, sometimes going in and having a second set of eyes look at things and help us brainstorm how best to do it is helpful. So that's what we've been doing, and that's what we will continue to do. Additionally, while we've been working with the Indiana State Department of Health, we are also working with local public health departments to maintain public safety and to ensure that folks are released safely back to the community. And I'll talk a little bit about that in just a second. And then again, we want to make ourselves available by opening the lines of communication with families, offenders themselves, staff, other folks in the community and stakeholders, so that we're sharing as much up-to-date information as possible. We have an agency of 27,000 offenders and almost 7,000 staff. We really want to make sure that we're getting the information to all of those folks who need to hear it. So we've developed various ways to communicate that message. We have an infocast, which is almost like a podcast for our staff every other day. We have a warden's call with our facility leaders every other day. We have a one-call system, which allows us to send a message out to all staff to keep them apprised of information. We've been putting information and signs up in the facilities and on the tablets so that the incarcerated individuals can learn the information for themselves and ask the questions when they are going to medical and educate, quite frankly, one another. So I wanted to go back to guidelines for release, and especially as we're talking about community stakeholders, what is DOC doing and what does that look like? So what we're doing is before anyone leaves, we have a screening process. So all folks who leave the Indiana Department of Correction are screened for COVID-19 symptoms, and we also perform a temperature check. So if a person has no symptoms, they don't have a fever, then we will, and they have not been in quarantine or isolation, then we will release them per our normal policy. If an individual does not clear the screening process, then we will make sure that we immediately put a face mask on that individual, place them under isolation, and evaluate them for COVID-19 testing. And then from there, if someone if COVID-19 is not detected, we will contact the local health department of the county that the offender is leaving to make sure that they are in the loop, that this person was symptomatic. The person either didn't have the test results back in time for release, because occasionally we will have an immediate release where we, by law, cannot hold them anymore. So we say, hey, the results are pending, or, they had to go before the results came back. Or, they were not COVID positive, but still have symptoms. We will contact the local public health department just to kind of give them a heads up. It also helps with contact tracing and things like that as well. We'll also provide additional guidance to the patient and the family to monitor symptoms, to isolate, to quarantine if that's what's needed, and then to follow up with their primary healthcare provider. That's another piece of this too, is making sure that folks leave with Medicaid activated so that they can receive the medical care and treatment that they need in the community. If someone is COVID positive, again, we will contact the family members ahead of time. We'll also contact the local health department and continue in any indicated medical care and provide patient education again to the patient and the family. So who's doing all this work to make sure that there is a smooth transition from the Department of Correction back to the community? Well, we have an amazing transitional healthcare team, and this team was started in the fall of 2019 under a vision that I had that all of the work that we do within the Department of Correction, so all the physical health care, all the behavioral health care that is provided inside, we definitely don't want the ball to drop once a person's released. We want to make sure that there's as smooth as possible the transition back out to the community. So backing up just a little bit, once a person arrives to Indiana Department of Correction, they have an intake process. They have a classification process. So based off their conviction, and the services that they may need from there, and the recommendations from that, and risk factors that may need to be taken into account, and just what we need to do to help rehabilitate this person is all taken into consideration. Now, that's from a correctional standpoint. We also have to get collateral information from a medical standpoint. So if this is a person who struggles with, mental health issues, we definitely want to get that information and that documentation from those providers. If there is an addiction issue, if there is uncontrolled diabetes or uncontrolled hypertension or any other physical health manifestations that may be uncontrolled or even just chronic in nature, we want to know that. We want to have all the information as possible. So once they're coming in, we can continue treatment and there's no lapses in care. One of the exciting things is being able to have that communication with providers and we're working to streamline our electronic medical record systems so that we're all on the same page and able to share records. So then a person arrives, they're classified, we have all the medical information, they've served their time, they're getting to the end of their sentence. Now, again, we have folks who are doing life sentences. So we may have some folks who never go through this entire path. And then we have some folks who are coming in and only doing a couple years. So as we prepare them for release, and we typically like to prepare release 6 to 12 months out from the date of release. So when you come in, we're almost starting to planning the release process and what that will need and what a person is going to need while they're with us. And then how do we ensure that they have that same access once they leave the facility. So when it comes to preparation for release, we coordinate the needs with the medical team. So we huddle up as a team and we say, hey, what is this person going to need? And we do this for each and every person who's leaving the department. And again, 6 to 12 months out so that we can plan this ahead of time. We identify any needs in the community if possible. Will they be able to go home to family? Do they need a nursing home? Is it someone who has dementia and won't be able to care for themselves? What kind of arrangements do we need to make there? Even if there is family, is the family going to be able to care for this person? For our folks who are suffering with severe mental illness, do they need a state hospital placement or a group home? Will they be going to our community transitions program or work release? So these are all questions that we try to figure out and plan ahead for. And then as they're leaving, so less than 90 days from the time that they release, we try to make sure that we make those appointments for them, that we provide a warm handoff to the community, that we ensure that we're doing our part to make sure that the next provider has access to the records, that medications and prescriptions and durable medical equipment, if needed, is in that person's hand and available for when they leave the door. And then, the day or the week that they're returning to the community, we again make sure that they have the appointment information and appointment follow-up. Do they have a ride there? Do they have clothes? Do they have whatever resources that they would need? And sometimes we don't think about, there's small things, childcare perhaps. I mean, it could be a various amount of things, but we want to make sure that there's no barriers to care. And then if there are, that we're aware of them, we're on top of them, and that we can mitigate them as soon as possible. We want to make sure that all of our offenders have access to care. So it's great if we can get them into an appointment, but it's not helpful if the appointment is 3, 4, 5, 6 months out. So we want to make sure that there's at least some kind of touch point for this person who's releasing, who has a medical need in a timely manner. Again, as I mentioned, we want to make sure transportation, housing, food, resources, employment, access. And this is really something that is important. We want to make sure that folks have, we know that education, right? The more education a person has, the more job skills that they will have, and the more gainful employment they'll have, and then the decreased risk of recidivism and coming back to the justice system. So we want to make sure that people are doing all those things while they're with us, and then once they leave, they can obtain employment, and that we can help connect them to that employment. We have a full hire team, which helps to ensure that folks that are leaving the Department of Correction have gainful employment so that they don't come back. And then for those folks who truly need additional help, we do work with other agencies to make sure Social Security, disability benefits are in place and they have all that they need to fill out that application, as well as folks qualify for BEAD services or developmental disability services, that we are helping advocate for them to get those services set up, TANF as well, and then any other social services that they may need to be successful in the community. I would say, what's the key to success? And really that's communication. I listed just 3 partners who we work with closely, and I've probably been on the phone with or in communication with weekly, if not daily. Right now, during this pandemic, I've been on the phone personally with NESA Department of Health at least twice a day, not including emails or any other kind of communication. But we really do want to make sure that from a public health standpoint, we are doing the right thing for folks and for communities through that we serve. And also, we want to make sure that folks have the social services that they need and the access to care. So we've been working with the Department of Mental Health Administration, so DMHA, to make sure that not only our offenders, but our staff, right, have access to behavioral health treatment that they need. And then we've been working with another partner, the Indiana Sheriff's Association, who really has, we've provided some guidance on, what does COVID-19 look like in a jail? In a jail setting, the turnover is much quicker. So someone may, average stay could be 5 days. And I know that the jail numbers are down, so they're not taking as many people in. But we've really had to work together as partners to make sure we're on the same accord. So we know who's coming from a jail to us, and then we're letting them know who's coming out and what our practices are as well. So it's really a coordinated effort to make sure there's no kinks in the system along the way. We've all had to figure this out together. It's a novel virus, and that brings a lot of new challenges for all of us. And these, again, are just 3 agencies that I've highlighted here, but it takes an entire village to do this work and to make sure that those we serve and our staff really have what they need during this pandemic. So now I want to talk a little bit about the impact. So as we move away from the response, well, what's the impact been? So what we've seen is the impact on staff. And I wanted to back up just a little bit to kind of explain stressors in a correctional environment. So I'm a board certified general psychiatrist. I am also a board certified child and adolescent psychiatrist. And quite frankly, in my training, we didn't learn about, the stress in correctional settings or public safety settings. And it really is a niche because the folks that go in and serve each and every day, they really take it serious about protecting the community, right? Safety and security. And there's a lot of challenges and a lot of opportunities that come with that. But a lot of times our folks who are going inside of a prison, you don't hear all the stories. So, our staff assaults, right? That's a real thing. Most times from a medical perspective, offenders see the medical team as someone who's there to help them because we're there to make sure that they're getting the care they need. We are there to make sure that their well-being is taken care of. We don't ask, well, what are you here for? And then deliver care based on that. It doesn't matter what you're there for. As a physician, as a nurse, we are there to make sure that the needs are taken care of. Now, the other side of that is, we also have folks who are there to make sure that the entire facility is staying safe and the entire facility is staying secure. And sometimes that includes telling folks no and enforcing policies and procedures that a lot of times, folks, don't want to do. So kind of changing bad habits and getting folks in line with following the rules, right? And 9 times out of 10, we have no issues. But there are certain facilities and certain populations where the stress is much higher. So during this pandemic, the impact on staff has, I think it's been a tough one. And again, some facilities are going to be much vulnerable than other facilities. But when you just think about the normal baseline, so all the stress that everyone's going to have at baseline, and then you think about incidental stress. So that's going to be, a colleague calls off work, so now you've got to pick up a double shift, or someone, a offender perhaps is not nice to you, to say the least, either has harsh words or tries to assault you or does assault you, right? So then you've got this incidental stress that comes. And then after doing this job, which you love because you love protecting the community, now you kind of develop this cumulative stress over time, right? And this cumulative stress for our folks can look like compassion fatigue. It can be tiredness. It could just be a decreased motivation and not wanting to come to work, a sadness, guilt from working all these long hours and working all of these shifts and that sort of thing. Okay, so now we've got normal stress, we've got incidental stress, we have cumulative stress, and on top of that, we add the stress of COVID-19. And am I sick and an asymptomatic carrier and now bring it into the workplace? Have I been exposed to COVID-19? Am I taking COVID-19 back to my home? All of these things, plus just a pandemic and the unknowns about them, add up to an impact on staff. So what are we doing about that? I think the first thing we have to do is pause for a second and recognize it. Be real to say that this is a huge impact on our staff. Another piece too that we've noticed is that our staff members have worked with us for a while. And sometimes their families have worked with us for a while. Most of our facilities are in rural areas, so the prison can be the number one employer around. And we've seen that, people who are serving life sentences, our staff get to know them. They may have been there for decades, and over the years, over time, these are offenders who really have contributed a lot to the facility. In a very meaningful way, and staff have gotten to know them. They aren't the same people. We all deserve a second chance, right? I know that I would want a second chance. I'm definitely not the same person that I was 10 years ago. So these folks really do change over the course of time, but due to their crimes, they're still with us. So staff, I guess what I'm trying to say is that staff get attached to some of these folks, and you do develop those relationships with appropriate boundaries in place, of course. And when you lose one of those offenders due to COVID-19, when one of those folks dies, that really can take a toll. So we had to, again, recognize that, pause for a second, and what can we do for our staff? So some things that we started to do is just purely recognizing them as heroes, and telling them that we are grateful for the work they do, that we appreciate the work they do, that we are thankful for them to continue coming in each and every day to do this work. We have provided coins as mementos, so to speak, for staff. We also have been doing other small things to show as tokens of appreciation. So either a meal, have like a meal for provide meals like boxed lunches and things like that for both shifts, so for day shift and for night shift, to make sure that we're just telling them thank you. We have snacks available, just again to say hang in there, keep going. We have been able to provide hazard pay for our staff, again just to recognize that these are challenging times and we appreciate what they're doing. Additionally, we have assembled mental health resources for our staff, and that, everyone's kind of different in what that looks like. So we are working now to finalize some on-site care models, but we've had the state EAP representatives come out and bring therapists with them, so we can just kind of do some crisis management, some check-in appointments with our staff to make sure that they're doing okay. We are going to expand our on-site services that we can provide to staff so that they can have that one-to-one contact and resource if they need to while they're at work and still be on the clock to receive that resource. We also have telehealth capabilities for staff if they want to actually go home and be in a more private setting. We have arranged telehealth services, and then again, one-on-one outpatient in the community with a private person, if that's what the staff member would like. So we're just, and then also groups. So we have had some very small groups, again, keeping social distancing in mind, but for our staff, if they want to kind of come together as a group, because again, this work, you have to look out for each other. You're always looking out over each other's back and making sure everyone's safe. So kind of doing these as small teams, small groups, just to kind of decompress, talk it out, support each other, have a safe space, and where we can be vulnerable to share some of our anxieties, concerns, all of those has been helpful. And, at first, we weren't quite sure if staff would take us up on these options, but the response so far has been overwhelming, and folks have come in to receive additional resources. So what's the impact on incarcerated individuals? The stance of the administration is that we are leaving it to the counties to decide if a sentence modification is in order, and we will honor a sentence modification for an incarcerated individual during this pandemic, and quite frankly, any other time. But we've really pushed a lot of education to our offenders to say these are the signs and symptoms to look out for from a physical health perspective, as well as these are the signs and symptoms to look out for from a mental health perspective. So folks who are dealing with baseline mental health or substance use issues, we've reminded them to be kind to your mind, to pause, to breathe, to feel in that moment, to take a break, to make sure you're keeping a routine, to sleep, to exercise, to stay connected with your family. And while we've limited volunteer and family visits, we still have allowed folks to have access on their tablets to family, and we've provided some visits free of charge as well so that they can still reach out to their family. And then we've encouraged folks to also seek help. So if they're feeling overwhelmed or unsafe, to let us know. We are there for them. We still have our full healthcare teams in all of our sites, and we're fully operational, and we want to be there to support people. I will say that our numbers of overdoses, serious suicide attempts, and completed suicides have been down thus far this year compared to last year. So overall, I think we are pushing information out. I know that our offenders are concerned. I want to hear that concern from not only the offenders, but the staff, so that we can make sure that they have access to correct and accurate information. And I think that as we've done that, some of the anxiety that staff and incarcerated individuals have experienced has really decreased. So just wanted to pause for a second and say that we really are all in this together. Again, the Department of Correction is 21 facilities spread out across the state, and not very many are in metropolitan areas. So most of our facilities are in more rural areas. So sometimes we're not seeing, and taking a minute to recognize our silent heroes and to highlight some of the work that not only our staff, but our offenders are doing during this pandemic has been helpful. And we've also had the National Guard come in and help us with perimeter patrols. We've had some medics come in and help us with medication distribution and triaging of patients and that sort of thing. And that has been helpful. Again, the State Department of Health has been a great partner. FSSA and various teams within that agency have been helpful to make sure that we can get folks out. We have had numerous community mental health centers reach out, not only for our staff, but for our offenders, just to make sure that, while our staff are at work, they have access to resources, and that when our offenders leave, that they have the ability to connect with mental health resources, behavioral health resources once they leave. So this is the end of my presentation. Again, I guess my final message in all of this and all that we're doing is just that it's a balancing act. We really are trying to refine our process as we go. We are trying to keep staff safe, keep staff healthy, keep incarcerated individuals safe, and keep incarcerated individuals healthy. And then not drop the ball when they leave. So when our staff go home and go back to the community, we want to make sure that they have access to testing, and that we're communicating to the local health department what a staff member's results may be. Additionally, we are wanting to make sure that our offenders, when they leave back to and return back to the community, that their families know their status, and that the local health departments are prepared to pick up the case and work with the releasing individual, and that our community mental health centers are in the loop, and our nursing homes and all the rest. It really is not work that one person does or one agency does. We are truly in this together. And again, my goal is that all the pieces stay in place and no ball gets dropped. Please feel free to reach out to me if you ever have any questions or concerns. My information is there, and I would love to hear from you. Thank you.